Thank you for providing me this opportunity to discuss my research project. This GU ASCO, we got the opportunity to present our study where we compared the tumor genomic landscape between smokers and non-smokers in patients with metastatic urothelial carcinoma. Smoking is a known risk factor for bladder cancer. Smoking induces oxidative stress on the bladder epithelium, which causes DNA damage through adduct formation. Previously reported studies from the Cancer Genomic Atlas Network have reported that smokers have higher frequency of mutational signatures such as ERCC2 and ApoBec when compared to non-smokers. This was a retrospective study where we included all patients who had a diagnosis of urothelial carcinoma and included patients who had an available comprehensive genomic profiling from a CLIA-certified lab. For our retrospective study, we collected data from the electronic medical record of patients from Huntsman Cancer Institute at the University of Utah. We divided the patients on the basis of their smoking status into two groups, the smokers and the non-smokers. The smokers included any patient who has had any history of prior smoking, or they may have been current smokers, while non-smokers included patients who had no history of smoking. For our study, we found that there were 137 patients who were found to be eligible, where 70 patients were smokers and 67 were non-smokers. We found that, for our study, we found that 137 patients were eligible, and out of that, 70 patients were smokers and 67 were non-smokers. We found that the highest number of genomic alterations in the smokers were found to be in TERT promoter, TP53, CDKN2B, and RB1 gene, while the highest number of genomic aberrations reported in the non-smoker was found in TERT promoter, TP53, CDKN2B, and PIK3CA gene. We also compared the tumor mutation burden between the groups, and we found that there was no significant difference between the two cohorts. Our findings are similar to the previously reported studies where there was no difference found in the targetable genomic mutations between smokers and non-smokers. Further studies need to focus on transcriptomic profiling to elucidate the effect of smoking on bladder cancer better.